Yes, very good evening to all. A fantastic evening. Can you hear my voice? My voice audible? Yes, fantastic evening. Just checking all the video and audio. Can you able to see the, come on, voice clear? Just once again. Yes, yeah, good. Yes. Okay, doctor. Today we're going to discuss the most important predicted question from INICET. We hope this may be going to come Sunday examination. With this, we're starting with the wasting time. We're going for topic proper to start. What are the important expected question from general pharmacology? Ready? To start. Maximally the asking question, how to excrete the drugs, how to excrete the drug, that one common question. And based on biology common question, receptor mediated mechanism action and log dose response curve, teratogenicity and clinical trial. These are the very hardcore area in general pharmacology. Okay, definitely you can trust this. We start. A patient consumed 100 tablets aspirin. What could be the next treatment? Ready? For treatment of aspirin poisoning, there is no specific antidote. Since acidic drug poisoning, we can promote by excretion urine by urine alkalization. Good answer is option B. And coming to option number A, N-acetylcysteine. It is an antidote for paracetamol. And extra point, it is also used as a mucolytic. And another interesting point, it is useful to control radio contrast induced nephrotoxicity. One more question, N-acetylcysteine also useful to control hematuria caused by cyclophosphamide. Normally, cyclophosphamide causing cystitis, for that specific antidote mesna, mercaptan with sulfonic acid. Along with the mesna as an adjuvant, we can supplement N-acetylcysteine also. And coming to option C, glucagon, it's an antidote for beta blocker poisoning. Okay, now we start next question. Drug inhibiting ATP binding cassette efflux. ATP binding cassette efflux. It is also called as ATP transporter or P-glycoprotein transporter or efflux transporter. The answer is verapamil. Of course, you know all the important drug acting by inhibiting P-glycoprotein, verapamil, amiodarone, cyclosporine, itraconazole, nifedipine, erythromycin, and quinine. Here, verapamil is the most potent P-glycoprotein inhibitor. Okay, next. Find out the true and false statement. Find out the true and false statement. I got an option with the options. Okay. Now, INH induces CYP2E1. It's a true statement. Here MCQ, isoniazid in general microsomal enzyme inhibitor. But only one exception, it may induces 2E1. Chronic intake of alcohol and isoniazids are inducing 2A1. Okay, and then spironolactone is the prodrug. No, it is an active drug. The active drug became most active form called candidate. Then vaporazole interfere clopidogrel. Yes, it is based on and CYP2C19 2C19 interaction. Clopidogrel is a prodrug. It needs activation by 2C19. Vaporazole inhibiting 2C19. So it's a true statement. Then CYP2D shows genetic variation. Yes, true statement. St. John's, what is enzyme inhibitor? No, false statement. It's an enzyme inducer. Enzyme inducer. So answer is option C. Very good. Next, the same enthusiasm you should maintain throughout this session, okay? Because I go step by step. GP, ANS, all system, including newer drug, expected latest drugs, all these things going to discuss. So, in the same enthusiasm you should maintain throughout the session. Ready? Theophylline dose needs to be increased if the patient is on. See, theophylline, a bronchodilator, undergo metabolism by CYP enzyme. So, a dose needs increase when you give with gracephalvin. Gracephalvin is a microsomal enzyme inducer, thereby causing rapid metabolism of theophylline. And remember, theophylline undergo metabolism by CYP1A2, whereas all the other options given in this questions are microsomal enzyme inhibitor. Okay, coming next question. Identify the drugs acting via mechanism shown in this image. First, look at this image. This image shows a cell membrane and the receptor. The receptor connected with a protein called G protein. That means it's a G protein coupled receptor and acting via adenyl cyclase pathway. That means asking which is acting via adenyl cyclase. Salbutamol, a beta 2 receptor agonist. All the beta 1, beta 2, beta 3 are GS. All betas are G stimulatory adenyl cyclase. Dobutamine, a beta 1 agonist, so it is also adenyl cyclase. Thyroxine acting on nucleus receptor. Phenylephrine is a alpha 1 agonist. Alpha 1 going to GQ pathway, that is phospholipase pathway. Bethanacol, it's a M3 agonist. All muscarinics are G1 coupled. In that M2, M4 are GI, whereas M1, M3, M5 are GQ. So here adenyl cyclase means the answer is option number A and B. That is answer A. A is the right answer. Good. All are doing very good job. Fantastic. Good. Now, just once again, there is small disturbance in my OBS. It's me connecting and reconnecting. So just don't get panic. It will come automatically. Okay. So it is agonist. It's a partial. It is antagonist. It's inverse. So which is indicating flumazenil. Flumazenil is a benzodiazepine antagonist. That means answer is option number C. Option number C. Very good. Very good. Whereas diazepam is a agonist and beta cobalamin is the inverse agonist of benzodiazepine receptor. Okay, good. So, coming next question. Which of following is the true about shown in the graph? I am giving graph. This graph says about log dose response curve. Here dealing with the efficacy and potency of the drug. So, which is true statement? Ready? B is more potent than A. No. A is the most potent. Okay. A is more efficacious than B. No. A and B are equal height. That means equal efficacy. False statement. Asking true. A and B are equal efficacious. Yes. A and B are equal efficacious. C is the non-competitive. No. C is the competitive. C is the non-competitive answer B. No, the right answer A and B are same efficacy. That's the right statement. Coming to next question. Teratogenicity based question. Come on. Lithium, a drug useful for bipolar, causes Epstein anomaly. That is tricuspid atresia. Thalidomide, a drug causing phocomelia. Warfarin causes Conradi syndrome, where the problem is maximally hypoplasia of the nose. Chlorphenicol causing gravis syndrome. So answer is option number A. Very good, ma. Very good. Next, new drug application. Come on, new drug application done after which phase of clinical trial? New drug application done after phase 3 trial. Remember, clinical trial based questions are very commonly coming in your AIMS exam. So be thorough on this. Okay. So new drug application done after phase 3. Very good. Now, in a clinical trial of 4 to 5 patient plan to take to find efficacy of new drug. Come on, patient plan to find out efficacy new drug in multicentric study. Efficacy multicentric. Half were given new drug and half placebo. So double blind and it's a placebo control trial. That means phase 3 trial. Phase 3 trial. It is phase 3. It is not B doctor. B means single center study. Single center. Multi-center mean always think of phase 3 clinical trial. So double blind phase 3 placebo control trial, phase 3 clinical trial. Okay. Now we done all the most important expected question from general pharmacology. One more thing in general pharmacology, sometimes they may ask calculation, sometimes they don't ask calculation. So distribution, what do you mean by VD, what do you mean by half-life, what do you mean by maintenance dose, the formula also sometimes they asking. That finishes clinic general pharmacology. Now coming to ANS, the most expected area for AIMS examination, ANS, foundation of pharmacology. So it must be thorough. We start looking. They're asking about in cholinergic, they're commonly asking about receptor agonist antagonist and clinically asking OPC poisoning treatment, Myasthenia gravis treatment, Alzheimer treatment. Anticholinergic also clinically drug useful for asthma, motion sickness, pre-anodication. The common area. We start MCQ. Expect the questions. Ready? Pyrinsipine, I given drug name and uses. Can you please match? Pyrinsipine, a M1 antagonist useful for treatment of gastritis. We have M1 antagonist, pyrinsipine and tiansipine useful for treatment of gastritis. Methacholine, a M3 agonist, methacholine is a M2 agonist acting on heart, useful for diagnosis asthma. We call methacholine challenge. So pyrinsipine useful for gastric ulcer, methacholine for asthma, and cevimeline, a M3 agonist acting on the glands, promoting salivation, lacrimation, useful for treatment of Sjogren's syndrome or xerostomia. Answer is option D. And bethanol M3 agonist acting on intestine, useful for treatment of post-operative atony of the intestine. So answer comes like D. Fantastic. Good. Now, a patient of mild to moderate dementia refused to take oral drug. Which of the following can be prescribed to this patient that can be used by some other route? For treatment of dementia, Alzheimer, all the options, memantine, donepezil, rivastigmine, candidate, all are oral drug. In this, rivastigmine used topically also. But today, come on, all are answering nicely. But today you should know we also have donepezil patches also there. So latest point, we have donepezil patch also. Remember, so among the cholinergic drug, donepezil, rivastigmine, both are available for topical use for treatment of dementia. Extra point, what is memantine? Memantine is an NMDA blocker useful for moderate to severe dementia. And extra one question today you should know. We have some monoclonal antibody approved for treatment Alzheimer, aducanumab and lecanemab. Aducanumab and lecanemab are monoclonal antibody targeting against beta amyloid. Aducanumab, lecanemab are monoclonal antibody targeting against beta amyloid, useful for Alzheimer. Okay. And next, regarding organophosphorus compound, find out the true and false statement. Right? Ecotherapy can cause cataracts. Yes, ecotherapy, a OPC compound. Once upon a time, it was used for treatment of glaucoma. but causing adverse effect of cataract, so not in use. Parathion, a organophosphorus, inhibiting enzyme by binding with the anionic site. False statement. Organophosphorus compound binding with the esteretic site only, not on the uh, anionic site. Okay. Propox is OPC. No, propox is a carbamate. Oxygen reactivating cholinesterase enzyme by binding with both anionic aesthetic. False statement. Oxygen reactivate cholinesterase only by binding with the anionic site only. Okay, and atropine reverses only the muscarinic symptom. Yes, atropine purely a anti-muscarinic agent. That means answer is option number A. Fantastic, good. Next. All of the following drug aggravate myasthenia gravis except. Can I answer this question? All of the following drug will aggravate myasthenia except neomycin, propranolol, celecoxib, quinine. The answer is option number C, celecoxib. See, neomycin, a aminoglycoside, propranolol, a beta blocker, quinine, a anti-malarial drug. All these drug has skeletal muscle relaxing property worsen myasthenia. Whereas celecoxib, what is this? It's the latest drug useful for treatment of myasthenia. So you know for myasthenia we have cholinesterase blocker like neostigmine, pyridostigmine, immunosuppressant like cyclosporine, azathioprine, all these no. But latest point we have some newer drug. For example, complement component C5 blocker like celecoxib and eculizumab. Both are complement component C5 blocker approved for treatment of myasthenia. In this, one more thing you should know, we have something called neonatal FC receptor antagonist. For example, if and one more drug called rozanolixizumab. If and rozanolixizumab both are neonatal FC receptor antagonists got approval for treatment of myasthenia. Rituximab useful myasthenia, that is CD20. Come on, Shagil, rituximab useful. I do agree, that is targeting against CD20. Okay, all these are newer drug useful for myasthenia. Coming next question. A patient was given atropine for the treatment of organophosphorus compound poisoning. Suddenly, he developed marked excitement and claims to see his late wife sitting next to him. That means atropine given overdose causing atropine toxicity. All of the following drug can be useful for treating this patient except patient was given atropine for treatment of OPC poisoning, developed atropine toxicity. So question, for treating atropine poisoning, what we can go for? For treating poisoning, for atropine poisoning, we can go for physostigmine, that is drug choice, okay, useful. And he is also have marked excitement and having some hallucination symptom and saying hallucination. To control this, I have to control by using some CNS depressant. For example, chlorpromazine is antipsychotic. Can we try? But it has anticholinergic property, so it cannot be useful for this case. Lorazepam can calm down the patient. It can be given. Neostigmine has no entry to CNS, so not useful. So for this case, all are useful. Physostigmine and lorazepam useful except is B and D. That means answer option C. Okay, answer option C. Next question. Regarding adrenergic, what are the important expected question? Okay. Which of following drug acting on beta receptor? Options are dipephrine, phenaldopam, meropenem, dopixamine. This type of question commonly expected. Dipephrine, a pro-drug of adrenaline acting alpha and beta receptor. Phenaldopam, a D1 agonist acting on kidney. Mirabegron, a beta-3 agonist acting on bladder. Dopixamine, a D1 plus beta-2 agonist. So, drug domain answers 1, 3 and 4. That means answer option number C. Good, good. Mirabegron, not M3, so beta-3. Come on, mirabegron, beta-3 agonist acting on bladder, causing detrusor relaxation, useful for treatment of overactive bladder. Coming next question. Sometimes they ask matching type of question. The given drug name and the receptor can match. Mirabegron, a beta 3 agonist. Beta 3 agonist. Indacaterol, a very longer acting beta 2 agonist. That means useful for COPD. And a cardio-selective beta blocker, beta 1 blocker, useful for asthma, useful for glaucoma, safe in asthmatic. Isoproterenol is a beta 1, beta 2 agonist. That means answer comes like A. Very good, ma. Answer A. Good. You are fantastically responding. Okay, good. Next, can you please answer? What is the drug of choice to control cardiovascular complication caused by scorpion bite? If there is scorpion bite, to control the cardiac problem, like or pulmonary edema and for pericarditis, what is the best drug of choice? Answer: prazosin. Prazosin, a alpha 1 blocker, it's a wonderful drug of choice to control cardiac complication caused by scorpion bites. Good. Next, a patient with Alzheimer's disease needs treatment for overactive bladder. Which is the best choice? Patient having Alzheimer's and he needs treatment for overactive bladder. What is the best? See, the option given are darifenacin, solifenacin, tolterodine, trospium. Remember, all the given options are anticholinergic. You know, anticholinergic useful for treatment of overactive bladder. But patient is Alzheimer. In Alzheimer, already there's a deficiency acetylcholine. So in this case, best is go for trospium because trospium is a quaternary ammonium compound, lipid insoluble. They don't disturb CNS actions. Thus why that's preferred for treating OAB in Alzheimer patient. Okay, next question. Sometime in INICET, definitely is one question based on drug acting on urinary bladder. A small point actor, what drug? For example, we have M3 antagonists like oxybutyrate, fluvoxate, tolterodine, trospium, and beta 3 agonist mirabegron. All are causing detriment or relaxation, useful for treatment of overactive bladder. Whereas M3 agonists like bethanacol, contracting bladder, useful for treatment of atony bladder and post-op atony other bladder. Whereas the called duloxetine, SNRI, antidepressant, causes increasing erythral tone. This property useful for treatment of stress incontinence. Suppose a female telling, even on coughing, even on laughing, there is a urination mean to control that we can try. And finally, we have tamsulosin, a alpha 1 blocker, causing internal urethral sphincter relaxation, useful for treatment of symptoms of benign prostatic hypertrophy. This is also very, very important aspect, and this is also very important. Okay, and coming to most effective drug for smoking cessation. One, most effective drug. All the given options here are drug useful for controlling smoking, but the most effective varenicline, a partial nicotinic agonist, varenicline. Again, varenicline also useful for treatment of dry eye disease, useful for dry eye disease and causing adverse effect of some psychiatric problem, causing depression, sometimes suicide tendency. And nicotine available as a patch, inhaler, lozenge, chewing gum. That's important. Next, coming to next system. We done general pharmacology, in pharmacology. Now I'm going to predict what are the important questions from CVS, renal and blood. Okay, to start. In this, they are asking mainly newer drug for heart failure, AR-based anti-arrhythmic classification, and very important pulmonary hypertension chapter. Very important. Okay, so we start. To start, matching type of question. Can I please answer? Drug name and the mechanism of action. Ready? Is a drug based on anti-arrhythmic. Quinidine, a class 1A drug, that means sodium blocker. Ibutylate, a potassium blocker, that means class 3 drug. Class 3 drug answers here. Digoxin in cardiology 2 point, having cardioinotropic action. As an inotrope acting by inhibiting sodium, potassium, it is pumped. As an anti-arrhythmic agent, it has vagomimetic property. as a vagomatic acting on AV node, reducing AV conduction. Esmolol, of course, esmolol, a cardio-selective beta-1 blocker that you know. So answer option number D. Fantastic, man. Good. All are doing good job. Next. Can you please answer this question? Disopyramide, imipyramide, and thiazide causes common adverse effect of what? Look here. 1A anti-retroviral, imipyramide a tricyclic antidepressant agent, and thiazide is an antipsychotic, phenothiazine antipsychotic. What is the common thing? All these three drugs has commonly anticholinergic property. As an anticholinergic, common thing, they cause constipation, they can cause QT prolongation also. So the B and C. Diarrhea is the wrong answer. Bronchospasm wrong answer. So answer is B and D. That means answer C. Good, good. Answer option C. Good. Next. In a patient with hyperkalemia, which drug should be stopped? This type of question very important. It's a medicine based question. For treatment of hyperkalemia, we have a lot of options. Now, what is to be avoided? Avoid A or B. Any drug blocking ROS pathway. ROS pathway blocker will cause adverse effect of hyperkalemia. So, they should be avoided. Okay. Coming next question. A patient who is on losartan present with HbA1c 8 gram, which of following should be preferred in this patient as an alternative to losartan? So, patient having hypertension as well as uncontrolled diabetes. In this patient, name the ARB able to control hypertension as well as diabetes. Mean go for telmisartan because it has PPAR gamma, PPAR peroxisome proliferator activated receptor gamma agonism property, thereby insulin sensitizing, thereby controlling diabetes also. Can you please answer? In this case, can I answer? Name the original PPAR agonist useful for treatment of diabetes. That is pioglitazone, a thiazolidine. So question. Pioglitazone, a anti-diabetic drug having PPAR gamma agonism. That means telmisartan has same property that of pioglitazone. Good, fantastic. Next. Just remember or revise newer drug useful for heart failure. We have istaroxime inhibiting sodium potassium pump. It's an inotropic agent. And then we have omecamtiv mecarbil. It's a direct myosin activator. It's a positive inotropic agent useful for heart failure. And then calcium sensitizer, pimobendan and levosimendan. Here levosimendan additionally having PDE3 blocking property also. Can you please answer? Name the original PDE3 blockers useful for heart failure. They call amrenin and milrenin. These are original PDE3 blockers useful for treatment of heart failure. Okay. And then serelaxin, relaxin analog acting by releasing nitric oxide. It's a vasodilator. Okay. And then we are having direct guanyl cyclase activator named by vericiguat. Vericiguat is a direct guanyl cyclase activator. And then we have mavacamten. Mavacamten actually a drug inhibiting myosin. It is approved for treatment of hypertrophic obstructive cardiomyopathy. Useful for treatment of obstructive cardiomyopathy. And again you should know we have something called neseritide. Neseritide, a brain natriuretic peptide analog. And then sacubitril, a neprilysin inhibitor. And of course, you should know omapatrelot and sampatrelot. Both are inhibiting neprilysin as well as angiotensin converting. Omapatrelot, sampatrelot inhibiting neprilysin as well as AC enzyme. Of course, you should know there are some anti-diabetic drug also useful for heart failure. For example, dapagliflozin, empa, and sotagliflozin all are AGLT2 blocker useful for treatment of heart failure. Okay, so find out the anti-diabetic drug useful for heart failure: dapagliflozin, EMPA, and one more thing, sotagliflozin. Okay, now can you go to this blue man syndrome caused by amiodarone and also causes cornea ventriculata. Now, please, my request, tomorrow just relax and read, just to have a look the images of the DVT images. DVT images are very useful. So tomorrow relax and see the images only. Okay. And one thing, can you please answer, doctor, name the drug useful for glaucoma causing adverse effect of cornea ventriculata or otus catabody. Can you please answer? Name the drug useful for treatment of glaucoma also causing otus catabody. That is nitarsudil. Nitarsudil and rifasudil. Both are Rho kinase enzyme blocker. They also reported to cause cornea ventriculata. Okay. Next, find out the right match. Find out the right match regarding drug and adverse effect. Ready? Hydrolysin causing heart failure, wrong match. Hydrolysin, in fact, along with the isosorbate dinylated, useful for treatment of heart failure. Adrenaline, no, wrong answer. Aliskiren causing hyperkalemia, wrong match. Verapamil, yes, verapamil causing constipation. This is very important. Among the CCB, verapamil causing maximum risk of constipation. Okay, next. Which of following drug approved for treatment of severe frostbite? Come on. Expected for this year because it's the latest MC question, man. Which of following drug approved for treatment of severe frostbite? Options of Riociguat, Bosentan, Iloprost, Selexipag, Sotatercept. Look here. All the given drug in these slides are useful for treatment of pulmonary hypertension. Remember, the right answer for this question is Iloprost. Iloprost, a PGI2, prostacyclin, PGI2 agonist. It's a prostacyclin analog, useful for pulmonary hypertension. Also recently got approval for treatment of frostbite. Then Riociguat, one more drug, Chinosiguat. These two are guanyl cyclase activator, bosentan endothelin receptor blocker, Selexipag PGI2 receptor stimulant. All are vasodilator, useful for treatment of pulmonary hypertension. Today you should know one latest drug called sotatercept. It is activin signaling inhibitor. It is also got approval for treatment of pulmonary hypertension. Sotatercept, activin signaling inhibitor. Of course, you should know Fasudil. Fasudil, a Rho kinase enzyme blocker. It is also useful for pulmonary hypertension. PD5 blocker, Sildenafil, Vardenafil, Avanafil. That's also okay. Next, regarding kidney chapter, the expected questions are ready. Matching type of question. That means diuretic drug name and the site of action based question. Ready? Match. Torsemide. Torsemide, a loop diuretic acting on thick ascending limb of loop of Henle. Acetylzolomide, a carbonic anhydrase enzyme blocker acting on PCT. PCT. Chlorothiazide, thiazide diuretic acting on distal convertible. Spironolactone, a potassium diuretic acting on collecting duct. Okay, so answer option number C. Very good. Now, can you please make a fast answer? Clinical question, diuretic and choice for treatment of ascites due to liver cirrhosis. What is the best diuretic? And spironolactone. Spironolactone is a fantastic drug of choice for treatment of ascites due to liver cirrhosis. Whereas in liver failure, which diuretic contraindicated mean go for acetylzolomide. It causes accumulation of ammonia, causing hepatic encephalopathy. And then name the diuretic in heart failure. For example, for rapid symptom relief for me, best is go for furosemide, a loop diuretic Fantastic. Whereas it's only for symptom relief. The drug going to modify disease in heart failure, spinal atom. Potassium diuretic, it's going to be disease modifying diuretic. Whereas which is a contraindicator in heart failure? Mannitol. Mannitol unsafe in hemorrhagic stroke and in pulmonary edema, because in these cases they're going to expand the extracellular fluid volume, so unsafe. And finally, name the diuretic causing kidney stones, mean think of loop diuretic. Loop diuretic causing loosening of calcium in the urine, causing calciuria, that be causing stones. Whereas stones are treated by thiazide. Thiazide causing calcium reabsorption, useful for treating stones. Whereas, can you please answer? Name the diuretic useful as a very good choice for treatment of mountain sickness, that is acetazolamide. The first line treatment for mountain sickness asks them to come down rapidly, rapid descent. Choice of drug mean go for acetazolamide. Okay. Now, this is also important. Drug useful for cranial diabetes insipidus, desmopressin, a V2 analog of vasopressin. Whereas drug of choice for treatment of lithium-induced diabetes insipidus, amiloride, a epithelial sodium channel blocker. And for nephrogenic diabetes insipidus, we can go for thiazide. Whereas for treatment of SIADH, that is for treatment of dilutional hyponatremia, choice is V2 blocker like lixivaptane, mosavaptane, tolvaptane. See, all are oral. Whereas we have one drug called conivaptane. This alone intravenous IV drug, and it acting on V1 as well as V2, mainly acting on V2. Okay. And coming to one latest expected question, name the diuretic useful to control heart failure in a diabetic kidney dissipation. It is one drug called phenerinan. Phenerinan, a mineralocorticoid receptor antagonist approved for controlling heart failure and repeated hospitalization in CKD patients. And then, very important expected question, I'm predicting this is going to come, doctor. That is endothelin and angiotensin 2 blocker useful for treatment of IgA nephropathy. Can you please answer? It is sparsentan. Fantastic, Ravadi. Definitely is going to come sparsentan. And then regarding blood shaft. In blood shaft, they are asking mainly about anticoagulant antidote, never antiplatelet, cholesterol lowering never drugs. For example, look here. Based on the image, find out the antiplatelet drug at the site mentioned in the arrow mark. The arrow mark is here. That is, I want glycoprotein 2B3A blocker. Answer, FT-fibatide. FT-fibatide, glycoprotein 2B3A. We have FT-fibatide, apixaban, and tirofiban. These are glycoprotein 2B3A blocker. Aspirin is a thromboxane A2 antagonist. Prasugrel, it's a P2Y2 blocker. Oropaxar, very important. We have atopaxar and oropaxars are PAR, protease activated receptor 1 antagonist. Ready? Warfarin causes these adverse effects shown in this image due to what mechanism? See, the image shows purple toe syndrome. Warfarin causing purple toe syndrome because of what? It is due to release of cholesterol emboli from atherosclerosis block. Answer C. Very good. Next question. Antidote. For warfarin, the specific antidote is K1 called phytonadione. It takes about 24 hours to bring down INR. So for rapid control bleeding, we can go for FFP, fresh frozen plasma. But today you should know, comparing to FFP, the latest one for rapid control of bleeding due to warfarin, we can go for 4-factor prothrombin complex. 4-factor prothrombin complex concentrate, which containing all the vitamin K dependent clotting factors, including 2, 7, 9, 10, also protein CS. That's the best. And finally, new word antidote. For example, we have oral direct 2A blocker. For example, dabigatran. Please answer. What is the specific antidote for dabigatran? It is idaruzumab. This is expected question. Antidote for dabigatran, idaruzumab. Dabigatran undergo renal route, so unsafe in kidney failure. And then oral direct 10A blockers are we have in apixaban, rivaroxaban. For this antidote, we have one thing called anti-Zenet alpha. It is an antidote for direct 10A blocker. But one more expected question for 10A and 2A. For both, we have one common antidote that's called siraparental. Siraparental, a common antidote for both direct 2A and 10A blocker. Okay, and then for thrombolytic drug, what are the antidote? We have something called epsilon aminocapric acid, tranexamic acid, and aprotinin. But question: if they given all the three options, among the three, what is the specific? Who is the specific antidote? Mean go for epsilon aminocapric acid. Okay, and finally, can you please answer what is the antidote for heparin? That is protamine sulfate. Protamine. And protamine is an alkali, heparin acid. So protamine antagonizing heparin, example for chemical antagonism. And one more thing, protamine partially antagonizing actions of LMWH, whereas for fondaparinus there is no specific antidote. Okay, next, very interesting question regarding cholesterol lowering agent. Look here. In the liver cells, we have LDL receptor. Can you please answer? The LDL receptor may undergo degradation by PCSK, that is pro-protein convertase cyclic acid. Now question, can you give me some example? Name some example for PCSK9 blocker useful for lowering LDL cholesterol. Yes, good. It is alirocumab and evolocumab. All are PCSK9 blocker given subcutaneously, useful for lowering LDL cholesterol expected. But compared to this, one more thing I am expecting, that is who is the we have a new drug called inclisiran. What is this? It is a drug inhibiting synthesis of PCSK9. So question, PCSK9 antagonists are alirocumab, evolocumab, whereas PCSK synthesis blocker is inclisiran. It is expected. Next, coming to CNS. In the CNS, every chapter important. In INICET, cancer, ANS, and CNS are everything important. So I just revision of entire CNS. Look here. Usually benzodiazepines are unsafe in liver disease. So question, which are the benzodiazepines safe in liver disease? For this answers we have temazepam, oxazepam, lorazepam. And once again, what is oxazepam? Oxazepam is the active metabolite of diazepam. That's also important. Okay, next, ready? Which of following is false statement about disulfiram? Can I answer? Which is false? It does not reduce craving. Yes, true statement. It is only for de-addiction. It is only for de-addiction, not for preventing craving. True. By asking what is false statement? Acting by inhibiting alcohol. False, false, false. It is acting by inhibiting aldehyde. Aldehyde is not alcohol. So it's a false statement. Can cause accumulation of acetaldehyde. Yes, that's why causing nausea, vomiting. We call disulfiram reaction. Used for de-addiction. Yes. So find false mean option B. Remember, doctor, disulfiram useful only for de-addiction, not for preventing craving. Can you answer? To prevent craving, we can go for naltrexone, or we can go for acamprosate. Now question starts. Naltrexone, a opioid antagonist. Whereas, anybody, what is acamprosate? Acamprosate is a GABA. It's a GABA agonist plus NMDA blocker. It's a GABA agonist plus NMDA blocker. That's all useful for preventing craving. Okay, next. Which of following is the novel antidepressant? Anybody? Which is novel antidepressant? Vilazodone, acenapine, lurasidone, belenozarin. Answer vilazodone. It is an antidepressant. The remaining options are atypical antipsychotic. Vilazodone we call SPARI, that is serotonin partial agonist and reuptake inhibitor. Serotonin partial agonist and reuptake blocker. Whereas remaining options are atypical antipsychotic. Okay, next. What is the FDA approved first drug for Rett syndrome? Rett syndrome. Answer riluzole, edaravone, trofinetide, tegretol. Answer trofinetide. Very good. It's a congenital neurological developmental disorder for this trofinetide. Riluzole, a NMDA blocker useful for treatment of ALS, amyotrophy lateral sclerosis. Edaravone, it's a antioxidant. It is also useful for ALS. Tegretol is a trade name, original name carbamazepine. Original name carbamazepine. Carbamazepine anti-epileptic. Now, ALS, this is also important for AIMS exam. For treatment of amyotrophic sclerosis, we have edaravone, a NMD blocker causing adverse effect of hepatotoxicity. Sorry, riluzole NMD blocker causing hepatotoxicity. Edaravone antioxidant and latest is tofersen antisense oligonucleotide. All are FDA approved drug for treatment of ALS. Next. This is another very expected question. Antidepressant causing priapism. Answer? It is trazodone. Okay. So for INICET, antidepressant and sex chapter very important. See, we have one group of drug called SSRI. They cause adverse effect of delay in ejaculation. Because of this adverse effect, SSRIs are exploited for treatment of premature ejaculation. Now question goes to all people. Can you please answer? Name the most commonly used SSRI for treatment of premature ejaculation. It is dapagliflozin. Dapagliflozin is most commonly used SSRI for this case. And trazodone, a antidepressant causing adverse effect of priapism. But you should know today which are the antidepressant causing less sexual side effect. Among the antidepressant, less sexual side effects are seen with mirtazapine, bupropion and nafazolone. They are causing less problem. Least is mirtazapine, then comes bupropion, then comes nafazolone. So antidepressant causing less sexual problems are mirtazapine, bupropion and nafazolone. And then this also expected, that is a female with hypoactive sexual desire disorder. For them to improve sex interest, we have oral. Name the oral drug mean that's called flibanserin. Flibanserin, it's a 5-HT1A agonist and 5-HT2 antagonist. Flibanserin, 5-HT1A receptor agonist and 5-HT2A antagonist. And remember, flibanserin should not taken with alcohol. If they take with alcohol, there's a high risk of hypotension and syncopal attack. This interaction. And can you please answer? For treating female with the HSDD, I have one injection. Name one injection given subcutaneously. That is bremelanotide. Bremelanotide. Look at the spelling. Bremelanotide. That means it's a melanocortin 4 receptor agonist given injection 45 minutes before sex. They are going to increase the sex mode. That's called injection. Okay. Next, newer drug useful for treatment of postpartum depression, brexanolone. Brexanolone, also called allopreganolone. It's given injection. Injection is a GABA analog, a neurosteroid approved for postpartum depression. Whereas oral drug, the orally given drug for treatment of postpartum depression, zuranolone. Zuranolone useful orally. Okay. Next, name the drug. Can I please answer? Name the drug given intranasal route for treatment depression. S-ketamine. We want to recall S-ketamine, a ketamine derivative NMDA blocker given intranasally for treatment of depression. Okay, next, ready? A pregnant female with a bipolar disorder has previous history of 4 episodes of mania bipolar. Okay, was started on lithium. There is no episode since past 1 year. She's now in third trimester and considered psychiatrist what? Okay, in third trimester and all already organophosphorus occurred, so no problem. In this case, ask her to take increased dose of lithium. In pregnancy, the dose requirement increases, so only in first trimester absolutely unsafe. In in third trimester, we can allow them to go for excess dose because they need more dose. The patient was started on amitriptyline and was found unconscious. Which of following does not suggest of TCA poisoning? Patient was on amitriptyline. It is a tricyclic antidepressant and developed a toxicity, which is not the symptom. Answer? It has anticholinergic property. That means it may cause hyperthermia. Very good, very good. It anticholinergic decreases sweating, thereby increasing temperature, risk of hyperthermia. Okay. And coming to this question, come on, sweetie Goyal. Now please answer this question. A mental health disorder patient admitted with the history of drug poisoning, present with seizure, comatose status. On examination, he had dilated pupil, dry mouth, high temperature, tachycardia, irregular heartbeat. Each is shown here what is most useful drug for treating this case. See, patient with mental health disorder with history of drug poisoning, having seizure, coma, and cardiac, cardiotoxicity, convulsion, coma. 3 C's are symptoms of TCA poisoning. So it's a case of TCA poisoning. And look at this here, there QT prolongation. For acquired long QT, the drug of choice MGSO4. MGSO4, a miscellaneous anti-arrhythmic, is a drug of choice for acquired long QT. Whereas quinidine, a class 1-year drug, amiodarone, class 3 drug, Diso also class 1-year drug. The class 1-year drug, class 3 drug causes adverse effect QT prolongation. So answer for the question, option number C, Maxell. Okay. And then, can I please look at this? This image shows synthesis, storage, release, and metabolism of GABA. Question: mechanism action of valproate mark at the site. I given A site, B site, C site, and D. Can I answer? Mechanism action? Yes, valproate inhibit GABA transaminase. Good. We have valproate. One more drug called. Name one more drug, most famous drug inhibiting GABA transaminase. There's also drug of choice for infantile spasm with TS, tuberculosis. We want to recall vigabatrin. It's a GABA transaminase enzyme blocker. Drug of choice for infantile spasm with tuberculosis. Okay. Whereas valproate going to promote the action of glutamic acid decarboxylase, and the drug inhibiting reuptake means think of tiagabine inhibiting reuptake GABA, and then the drug going to promoting release of GABA from the vesicle, or we have something called levetiracetam, and one more drug called breveracetam. They're going to promote release of GABA from synapse called ligand for SV2A. Okay, next. Which of following adverse effects is seen more commonly with oxcarbazepine as compared to carbazepine? See, carbazepine, a drug useful for epilepsy disorder. From the carbazepine, we want to think of oxcarbazepine. Oxcarbazepine having less adverse effect except causing more. It causes more SIADH, so risk of more dilutional hyponatremia. Good man, good. Next. A patient on fluoxetine therapy was given another drug for pain control. pain control. After 2 weeks, he developed altered conscious and QT prolongation. Which drug likely the answer? See, patient was on fluoxetine. It has microsomal enzyme inhibitory property. Patient was taken pain control. All the given options are opioid group of pain controller. When this, which is causing QT prolongation, methadone, a opioid causing adverse effect of QT prolongation. Methadone, a opioid useful for pain management as well as a fantastic drug for de-addiction of alcohol. Is also very good choice for de-addiction of opioids. For morphine de-addiction is a drug choice. Okay, and then next coming to endocrinology. Ready? Which of the following agent is given prior to thyroid surgery to decrease blood loss during operation? Answer: potassium iodide. Potassium, also called lugal iodine. It's a mixture of 5% iodine, 10% potassium iodide. It is actually a fastest acting drug, acting by decreasing release of T3 T4 follicle. It is going to decreases vascularity of the gland that be useful for pre-operative preparation. Lugal iodine. Okay. Next, which of following DPP4 blocker is given in CKD patient without dose modification? Look here. All the gluten undergo renal route of excretion. So glutens are unsafe in KD disease except Lina. Lina gluten undergo excretion via bile. This very, very, very important question. And then a lady on oral hypoglycemic developed vulvovaginal pruritus, drug responsible for this side effect. Okay. Among the anti-diabetic drug, a drug causing severe urinary tract infection, especially fungal infection, is AGLT2 blocker. For example, in this canagliflozin. Thus, when telling after in our DVT session, we discuss detailedly all the picture-based adverse effect of all anti-diabetic drug. So please kindly go through tomorrow just images alone and some definitely 50% question going to come that alone. So utilize this clearly. Okay. Next. Which anti-diabetic drug is recently approved for treatment of heart failure with low ejection fraction with impaired kidney function? That means, doctor, you should know there are some anti-diabetic drugs useful for heart failure, also having renoprotective. For example, SGLT2 blocker. They have cardioprotective plus nephroprotective. So the answer is AGLT2 blocker like empagliflozin. In this junction, can you please answer anybody? Name some anti-diabetic drug causing heart failure. Can answer? Name some anti-diabetic drug causing heart failure. For example, pioglitazone causing heart failure. Already we have one drug called Rosi. Rosiglitazone was already withdrawn because of heart failure. Whereas pioglitazone may cause heart failure. That's why unsafe in heart failure. And one more thing, we have Saxa. Saxaglutine, a gluten. It is also reported to cause heart failure. So be careful. Next. A child with type 1 diabetes presenting with acidosis and blood sugar of 400 milligram per deciliter was started IV fluid. What the further management? See, from the history, we can say type 1 diabetes with acidosis. That means diabetic ketoacidosis. For this, first in choice, go for IV fluid. Next, what I should do? Here, first control dehydration by fluid. Next, control diabetes with insulin stat dose followed by IV infusion. The answer is option number B. Option B. Okay. See, this is what confusion. Come on, all are telling CC. Wait. First 1 hour normal sign. That's okay. followed by infusion. It is not answer. Give start first 1 hour, give saline, then instead dose insulin, followed by insulin infusion, not straight away infusion. The guideline says first start dose insulin zero point 0.1 unit per kg IV start, followed by zero point 0.1 unit kg per hour IV infusion. So remember, doctor, remember, first I go for IV fluid, that is okay, followed by start dose of insulin and then IV infusion. This dose, it is from Harrison book. Please go through this, okay? And then I just make a fast answer. Name the cholesterol lowering drug approved for treatment of type 2 diabetes. It is Colisavalum. Okay, and then this what expected for this INICET. Name the dual GIP and GLP agonist approved for treatment of type 2 diabetes, and that is also useful for treatment of obesity. What drug? It is tirzepatide. Hey, Temple is wrong answer. Nikita, teplizumab drug useful for type 1 diabetes. That is different. My question, GIP, glucose dependent insulinotropic polypeptide, plus GLP, glucagon like peptide analog, useful for this case tirzepatide, a latest FDA approved drug for type 2 diabetes as well as for treatment of obesity. And then name the group of drug causing atypical femoral fracture called chalk stick fracture, also called stress fracture. It is bisphosphonate. And then name the SCRM useful for treatment of dyspareunia. Dyspareunia means pain during coitus. There's a dryness of vagina. To treat that, we use one called ospimefen. It's a latest SCRM useful for treatment of dyspareunia. Okay. Next. Which of following drug is bone forming drug? That is osteoblast. Name the osteoblast. Vitamin D, bisphosphonate, teriparatide, calcitonin. Answer is teriparatide. We have teriparatide. One more thing, abaloparatide. Both are human parathormone analog. They are the most wonderful osteoblastic drug. But the problem is they use only for 1 year, maximum 1.5 year, not more than that. Chronic therapy of teriparatide, abaloparatide may cause risk of osteosarcoma. Danger. Vitamin D can be osteoblast, but best is teriparatide. Bisphosphonate inhibiting osteoclast. Calcium also inhibiting osteoclastic action. Can you answer? Name the drug. Come on. Name the drug promoting osteoblast and the same drug inhibiting osteoclast. Which they are having dual action. It is strontium ranolate. Very good, ma. Very good. Next, we go for this. In AutoCAD, you please revise DMOD target. For example, biological DMOD. We have TNF alpha blocker, IL-1 blocker, IL-6 blocker, and B cell, T cell activation blocker. So target very important. One question I want to ask. Come on. Name the most popular interleukin 1 blocker. That is, anakinra. Sorry, IL-1 blocker anakinra. That is easy. Whereas name one IL-6 interleukin 6 blocker. It is what most important drug name? Tocilizumab. One more drug, sarilumab. These are IL-6 blocker, very important. Infliximab, TNF alpha blocker. I'm asking IL-6 blocker, tocilizumab and sarilumab. Okay, and come to this question. In migraine, latest drugs are very important. Come on, tofacitinib Janus kinase enzyme blocker. Okay, now migraine for INICET, migraine very important. For example, name some newer drug, that is calcitonin gene related peptide antagonist. All name ends with the Giband. All say Giband. telcagiban, etogiban. Here, what is important? Look here. The obrogiban, remigiban, useful for acute migraine. This for prophylaxis. One latest point, we have Savigiban used spray form. Like we have one thing called tripton, and one more thing zolmitriptan. They also given as a nest spray form. Similarly, the Giban useful nasally CB and then we have something called antibody, which are the monoclonal antibody targeting against CRP. For example, erinumab, fremanizumab, galganizumab, eptinizumab. And finally, most important, can you please answer? Name any 5ST1F 1F agonist approved for treatment of acute migraine. Name one 5:1F agonist approved for treatment of acute migraine. We want to call lasmiditan. See, the triptans are 5:1BD agonist, whereas lasmiditan 5:1F agonist. Okay, next, ready? Find out the drug useful in gout. Reduces risk of cardiovascular risk, like controlling heart attack, controlling heart failure. Anybody? Name the drug useful for gout. Control this. Options are allopurinol, febuxostat, colchicine, rasburicase. Answer: it is colchicine. A latest finding, new clinical trial shows colchicine able to control cardiovascular mortality. Allopurinol causes adverse effect of Stevens-Jones syndrome and toxic epidermal necrosis. Febuxostat causing adverse effect of cardiac problem and stroke problem. Rasburicase contraindicated in patient with the G6PD deficiency patient. In this patient, definitely risk of causing hemolytic anemia. Then, what about anti-microbial? Usually, for INICET, anti-microbial, they least focus. They're mainly focusing CNS, ANS, autocoid, and sometimes anti-cancer immunology. This is also least focus, but mainly asking about TB, HIV, fungus, and in antibiotic, common drugs, mechanism action based question, and common ADR. Now, look at this. The expected question: which are the following drug? Which of following is the true about anti-TB drug? True statement. Isoniazid is a mycalic acid synthesis inhibitor. Yes, true statement. Rifampicin useful only for TB? False. It is useful for TB, leprosy, even for meningococcal meningitis carrier. Pyrazinamide induces no. Pyrazinamide and ethambutol neither enzyme inducer nor inhibitor. False statement. Bedaquiline is a ATP synthase inhibitor. True statement. So the answer is option number C. Very good, ma. Very good. Next, which of following anti-retroviral drug causing palm and sole pigmentation? Come on, palm and sole. The answer: emtricitabine. See, emtricitabine causing palm and sole. Zolpidem causing nail and skin pigmentation. And emtricitabine plus tenofovir, a wonderful combo for pre-exposure prophylaxis. Okay, and abacavir may cause severe Stevens-Jones syndrome in patient with HLB 5702 allele patient. So I think we made a thing, that is we made TB, HIV. We have separate program in our DV in our DAMS. We covered TB and HIV in detail. So go through that also. Now today, emtricitabine causes palm and sole pigmentation. This type of question common regarding mechanism action of anti-retroviral drug, which are following agent acting on site mentioned C in this image. See, A mean fusion blocker, B mean reverse transcript blocker, C mean integrase blocker, D mean protease. So I want integrase enzyme blocker. Drug name raltegravir. all the gravir, VI mean VI virus, grav, integrase, raltigravir, pictigravir, dolutegravir, all are important. Okay, and it is fusion inhibitor. Nevirapine, it's a non-nucleoside reverse transcriptase inhibitor. Indinavir protease inhibitor. Okay, ready? Which of the following is false regarding mechanism of action of antimicrobialism? False. Rifampicin inhibiting DNA-dependent RNA polymerase? Yes, true statement. Linezolid binding on 30? False, false, false. It binding on 50S ribosome? False statement. Daptomycin causing deep cell membrane? Yes, true statement. Osteonorm acting by inhibiting cell wall synthesis? Yes, it's an atypical beta-lactam drug inhibiting cell wall. So answer B. This type of question important, doctor. Can you please list out, name some antibiotic acting on 30S ribosome and inhibiting protein synthesis? For example, mnemonic at 30. That is aminoglycoside and tetracycline. Very good. And acting on 50S mean mnemonic cells, CELLS, chlorphenicol, erythro, that means macrolides, linezolid, and then lincosamide called clindamycin, S for streptogramine, acting on 50S ribosome. Okay, good ma, all are good, 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 fantastically responding, good ma. Next, already a young patient on treatment with the drug for MD or TB presenting with weight gain, cold intolerance, and lethargy. And investigation shows there's a high level of TSH, a low level of T34. That means developed hypothyroidism. Now, please answer. Name the drug useful for MDR TB causing hypothyroidism. Answer ethiopia. Very good. Ethiopia and PAS. We have something called ethiopia and para-aminosalicylate. Second line drug useful for MDR TB causing risk of hypothyroidism. They are acting by inhibiting synthesis of T3, T4, thereby causing hypothyroidism. Whereas we have cycloserine and isoniazid. They causing adverse effect psychosis. So anti-TB drug cause psychosis, isoniazid and cycloserine. Whereas anti-TB drug causing uveitis, rifabutin. This also expected. Anti-TB drug causing uveitis, rifabutin. Next, a hemophilia patient took anti-retroviral drug and developed side effects with signs of increased induction tension, like an altered mental status. Which drug responsible? Okay, patient hemophilia. There's one drug used for HIV causing intracranial hemorrhage. The drug name is tipranavir. It's a sulfonamide derivative causing adverse effect of intracranial hemorrhage, thus causing ICT. This is also important. Okay. Then, ready? Which of the following antiviral drug acting on the site mentioned 2 in this diagram? Anybody? Here 1, 2, 3 I mentioned, no? Which drug inhibiting? 2. 2 mean the drug inhibiting RNA, that is called ribavirin. Ribavirin inhibiting RNA protein synthesis. Okay. Whereas amantadine and rimantadine, these two are acting by inhibiting uncoating. Whereas zenamavir, peramivir, and one more drug, oseltamivir, these three are inhibiting release. That is neuraminidase blocker, viral release blocker. Repeating, this slide shows drugs useful for treatment of influenza virus infection. Here, amantadine and rimantadine useful only for influenza A virus. Mechanism action inhibiting virus uncoating. Ribavirin inhibiting RNA, and zenamivir, peramivir, and oseltamivir inhibiting viral release, called neuraminidase inhibitor. Okay. Next, Can you please answer? What is the drug of choice for treating this condition? What is the drug of choice for? Look at the fly and look at the size and tell me what is the choice. It's a case of Chagos, drug of choice benzimidazole, drug of choice benzimidazole. Other choice can be nifurtimox, Chagos disease, benzimidazole choice. Other option can be nifurtimox. Okay, and coming to next very vital topic. Don't deviate even a single second accountable. So very important topic, expected topic. Look here the anti-cancer, some drugs, some condition choice, and very commonly asking about anti-cancer ADR and treatment for anti-cancer toxicity. Common. Shagil sir, dangerous topic. Hey, not dangerous. It's a going scoring topic. You are going to score. This is going to come definitely. We're expecting. By God grace, it's going to come and you are going to get a very good score. Okay, it's a scoring topic. Come on, we enjoy. Come on. Rituximab targeting against dash. Answer CD20. It's a target. Sometimes target based questions are commonly coming after. So rituximab targeting against CD20. Okay, I'm starting with the simple points and then we go for high level points. Next, matching type of question. I given drug name and the targets. Okay, so can you please match? Trastuzumab, a monoclonal antibody targeting against HER2 receptor, useful for treatment of HER2 positive breast cancer. Okay, next, infliximab, a TNF alpha blocker, useful for treatment of rheumatoid arthritis. Then imatinib, a drug targeting against BCR-ABL and a drug of choice for CML, chronic myeloid leukemia. Sirolimus, a immunosuppressant targeting against mTOR, that is interleukin 2 receptor blocker. That is called sirolimus. Everolimus, mTOR blocker, whereas we have something called cyclosporine and tacrolimus. They are calcineurin blocker. That means interleukin 2 synthesis inhibitor. Cyclosporine, tacrolimus are interleukin 2 synth blocker. Sirolimus and everolimus are IL-2 receptor blocker. So answer comes option number C. Okay. Now, drug useful for trastuzumab resistant HER2 positive breast cancer. See, normally for HER2 positive cancer, we go for trastuzumab. If resistant, what else can be used? Can you work out? Option given are lapatinib, sorafenib, vemurafenib, and elum. Is good. The answer is lapatinib. We have lapatinib, neratinib, both are tyrosine kinase enzyme blocker useful for breast cancer. Whereas I show sorafenib, a VEGFR, vascular growth factor receptor blocker useful for RCC, renal cancer, and for hepatocellular cancer, and it's a very good choice for hepatocellular cancer. And erlotinib, it's epidermal growth factor EGF blocker useful for metastatic non-small cell lung cancer. Vemurafenib, RAF, useful for melanoma. And this is what expected question, that is which are the tyrosine kinase enzyme blocker useful for treatment of breast cancer. We have something called lapatinib and neratinib. Lapatinib targeting against HER1 and HER2 positive breast cancer, whereas neratinib targeting against HER1, HER2 and HER4 positive breast cancer. Anyway, the tyrosine kinase enzyme blocker useful for treatment of breast cancer are lapatinib and neratinib. Important. Can you please match this question? That is, I given drug name and the mechanism action. Come on, matching palbociclib. See, palbociclib. When a drug name ending ciclib, palbociclib ribociclib, abemaciclib, all are inhibiting CDK, cyclin dependent kinase 4/6 enzyme blocker, useful for treatment of breast cancer. Pentostatin, a drug of choice for hairy cell leukemia. It is acting by inhibiting adenosine deaminase enzyme. Rucaparib, spelling parib, PAR, that is poly A, adenosine diphosphate RI, ribose polymerase inhibitor. That means this one. Useful for breast cancer, ovarian cancer. Vismodegib, those drug name any jib, they call Hedgehog signaling pathway blocker. That means answer is option number A. Okay, very good. All are doing good job, good job. Next, come on, again matching type of question. I given drug name and the side effect. Can I match drug name and side effect? Ready? Capecitabine. See, among the anti-cancer drug, it is the one causes maximum risk of hand-foot syndrome. Actually, it's a pro-drug. It's a pro-drug of 5FU. Among all anti-cancer drugs, it is one causing maximum risk of hand-foot syndrome. Cytarabine, it causes cerebellum ataxia and dysarthria, difficulty in speech. And then L-asparginase causes hemorrhagic pancreatitis and hypercoagulation. It causes pancreatitis and hypercoagulation. And cyclophosphamide may cause cardiotoxicity, cystitis, all these things. And I think last year, before that, they asking what is the metabolite of cyclophosphamide. They ask about the metabolite, that is we having aldophosphamide, phosphomustard, acrolein based on the metabolite. Also, one old question came. So the answer for this question, option number B. Okay, good. For yes, good. Corora Roja, very good mark. Corora Roja, yes. They ask you 4-hydroxy cyclophosphamide. That's a metabolite of cyclophosphamide. It was old question. Okay, good. And can you please answer this type of question? Important image-based question. Name the anti-cancer drug causing mucocutaneous reaction, flagellated pigmentation on skin. Very simple. Yes, good. Bleomycin. Bleomycin, a antibiotic anti-cancer drug. Remember, doctor, all antibiotic anti-cancer drugs are cell cycle non-specific, but it is cell cycle specific, acting on G2 phase and also causing adverse effect of pulmonary fibrosis. That's also important. Okay, and then anybody? Name the drug useful to prevent Dynaresin-induced cardiotoxicity. Look here, Dynaresin, and then we have something called doxorubicin, and then metazandrone. All are anthracycline antibiotic. They cause cardiotoxicity. To control the use one called desraxazine. What is this? It's an iron chelator. Useful to control doxorubicin or Dynaresin-induced cardiotoxicity. Can you please answer? What is aprepitant? Aprepitant is a NK, neurokinin 1 blocker, useful for treatment of late phase vomiting due to anti-cancer chemotherapy. We have aprepitant, fosaprepitant, rolapitant, nitipitant, all are NK1 blocker, useful for treatment of late phase vomiting due to cancer chemotherapy. And then amifastine, it's an antidote for cisplatin. Cisplatin, a most emetogenic anti-cancer drug, causing adverse effect of nephrotoxicity. To control the nephrotoxicity due to cisplatin, we can try amifastine. Dexamethasone, a steroid, useful as an anti-emetic in cancer patient as well as useful for treating cancer. Okay, that is Dexa. And then you should know this point. Easy question, but important question. Common anti-cancer drug and the common antidote. For example, methotrexate mean antidote, leucovorin, also called folinic acid. And one more thing, we have one thing called glucorbidase. Glucorbidase. It is useful for treatment of methotrexate toxicity in patient with kidney disease. In kidney disease patient, we can try this one. And then for doxorubicin, just now discuss dexraxazine. It's an iron chelator given along with vitamin E. Vitamin E is an antioxidant. And then for cyclophosphamide, we use mesna, mercaptoethane sulfonic acid. And for cisplatin, we can go for amifostine. And anti-cancer causing mucosal ulcer, mouth ulcer, further we use topically palifermin. And then VOD, veno occlusive dissolver, also called hepatic vein thrombosis, also called Budd-Chiari syndrome. For this, to control the thrombosis, we need antithrombotic, that is defibrotide. It's an antithrombotic useful to control hepatic vein thrombosis due to alkylating drug. Alkylating agents are causing maximally hepatic vein thrombosis. To control that, we can use defibrotide. And then this was I told. For cyclosamide, we go for mesna. For doxorubicin, we go for dexraxone. And for cisplatin, we go for amifostine. And then this again very important. Anti-cancer drug causing myelosuppression. It can be neutropenia, or it can be anemia, or it can be a thrombocytopenia. So you should know, please answer. For treatment of neutropenia, we have something called colony stimulating factors like filgrastim or pegfilgrastim. For treatment of anemia, we can have erythropoietin preparation like epoetin. And for thrombocytopenia, can you please answer? It is the expected question. Come on. For what is the most common? Name the most common drug useful for treatment of anti-cancer drug-induced thrombo. Yes, good. Opervikin. Opervikin is IL-11, interleukin 11 analog. Opervikin spelling. Opervikin, interleukin 11 analog. That's the most famous drug useful for treatment of anti-cancer drug-induced thrombocytopenia. Okay, and then come on. Present with purpura, diagnosed as isolated thrombocytopenia or immune thrombocytopenic purpura. Name the tyrosine kinase blocker useful for this case. It is called fostamatinib. This also important. Fostamatinib, a tyrosine kinase enzyme blocker useful for treatment of immune thrombocytopenia. Actually, for this case, first line drug choice means steroid. Other option, we can also go for rituximab. Now, the other drug useful for this case, for treatment of thrombocytopenia, we can go for something called I'll show in next slide. Go for thrombopoietic growth factor like L-thrombobac, roemplastin. I will show in next slide. Wait for some time. And opervikin IL-11 analog for treatment of thrombocytopenia due to anti-cancer. L-thrombobac, a thrombopoietic factor, can be useful for ITP. And bosutinib is a tyrosine molecule useful for CML. Now, this is what important question. A latest MCQ prepared it. Come on. Avatrombobac, approved for treatment of what? Avatrombobac. That means thrombopoietic growth factor useful for chronic immune thrombocytopenic purpura. For example, for this case, For treating this case, we have thrombopoietin receptor agonist like L-thrombobag and romifrazim. L-thrombobag and romifrazim of thrombopoietin growth factor useful for ITP. Of course, tyrosine kinase enzyme blocker useful for these cases. Fostamatinib. Of course, for CML, you know imatinib and SLE I am going to show belimumab. You want to recall belimumab useful for SLE. Of course, neutropenia we are using something called recombinant granulocyte colony 20 factor like filgrastim, pegfilgrastim, lenagrastim, and recombinant granulocyte monocyte colony 20 factors we have sargramostim, malgramstim. All are useful for treatment of anti-cancer drug-induced neutropenia. Neutropenia. Okay. Next. Which of following drug targeting against CTLA, cytotoxic T lymphocyte associated antigen 4, CTLA? Answer? The answer is ipilimumab. See, CTLA is a target, immune checkpoint inhibitor. So you should study, man. Immune checkpoint blocker, very important for INICET. Okay. Now, in this one question, the golimumab, it is a drug useful for melanoma. It's a CTLA blocker. Golimumab, you know, TNF alpha blocker, useful for rheumatoid arthritis. And extra point, look here, just wait. Ipilimumab, it's a CTLA4 blocker. Similar to that, we have tremelimumab. Come on, Shaigil Shah, very fantastic, mom. We have tremelimumab. It is also CTLA4 blocker, useful for melanoma. And then we have nivolumab, pembrolizumab. These are PD, programmed death one factor blocker, useful for non-small cell lung cancer. And then atezolizumab, it's useful for non-small cell lung cancer and for urothelial cancer. Okay. And golimumab for rheumatoid arthritis. Isquizumab, it is also expected. It is an interleukin 17 blocker, useful for treatment of moderate to severe psoriasis. Okay, and nesitumab is an EGF blocker, useful for non-small cell lung cancer. But in this, for INICET, I am predicting PD, that is immune checkpoint blockers are very, very important because they are the one latest in oncology. Okay, we go PD1, programmed death one blocker, nivolumab and pembrolizumab. CTLA4 blocker, ipilimumab and tremelimumab. And PDL, that is programmed with ligand 1 blocker, atezolizumab and durvalumab. Atezolizumab and durvalumab, PDL1 blocker. Okay. Next, these are useful for melanoma, and this useful for melanoma plus urothelial cancer. These are useful for urothelial cancer also. And very simple straight question, come on. Which of following drug acting by inhibiting the site mentioned in the arrow mark in the image and useful for treatment of anti-retroviral drug-induced diarrhea? Come on. A drug inhibiting CFTR, a cystic fibrosis transmembrane regulator. The drug name is crofelemer. Crofelemer, useful for treatment of anti-retroviral drug-induced diarrhea. Pliconotide, it's a CFTR activator, useful for treatment of constipation, domin IBS. Then telotristat is the tryptophan hydroxylase blocker, useful for treatment of carcinoid diarrhea. But originally, can I please answer? Originally, for treatment of carcinoid diarrhea, drug choice is octreotide. octreotide is the drug of choice for caution diarrhea. And then naldimetide is a peripheral opioid antagonist useful for treatment of opioid-induced constipation. We have naldimetide, methyl naltrexone, naloxegol, and albumin all are peripheral opioid antagonists useful for treatment of opioid-induced constipation. And then make a fast revision, very important. Name the drug useful in gastritis having mineralocorticoid like toxic action. A drug called ulcer healing drug having mineralocorticoid action causing sodium water retention, causing hypertension and hypokalemia. Drug name carbendazole. It's a ulcer healing drug. Okay, and then name the drug useful in irritable bowel syndrome causes adverse effect of ischemic colitis. Allocertan. Allocertan, a 5-HT3 antagonist, causes ischemia of the colon. It was withdrawn but later reintroduced and used only for female with IBS and with informed consent. When you want to use this, you must get informed consent from the patient because causing ischemic colitis. Then name the drug useful in bowel disorder causing melanosis coli, that is pigmentation of colon, called senna. Senna is the herbal medicine useful for treatment of constipation causing pigmentation of colon, senna. And then very important, name the alpha 4 beta 7 integrin antagonist useful for IBD. It is vedolizumab. Vedolizumab alpha 4 beta 7 blocker useful for treatment of inflammatory bowel disorder. Vedolizumab. And can you please answer? Name the gallstone dissolving agent useful in biliary cholangitis. It is ursodeoxycholic acid, a gallstone dissolving agent useful for treatment of biliary cholangitis. Ursodeoxy, not fib. Come on. Shagil, fibrates are causing gallstone. For example, gemfibrocil causing bile stone, gallstone, masking ursodeoxycholic acid useful for treatment of cholangitis. Okay, right. Which of following drug useful for treatment of short bowel syndrome? Answer: it is teduglutide. Teduglutide, a GLP-2 analog useful for treatment of short bowel syndrome, increases fluid and nutrient absorption but causes adverse effect of chance of bowel cancer possibility. And then crofelemer, just now discussed, it's a CFTR blocker useful for treatment of anti-retroviral drug-induced diarrhea. Allocertan useful for treatment of IBS, diarrheal IBS causing adverse effect of ischemic. Ilixadoline, it's a opioid. So opioid useful for treatment of diarrheal IBS. Okay. Next, hereafter you must be very alert because I'm going to talk some new point. May be difficult to follow, but you must know. Okay. Now, which of following drug useful in glaucoma increases trabecular outflow? Come on, name the drug useful for glaucoma increasing trabecular outflow. Answer: nitazoxanide. Very good. Nitazoxanide and ripazodil, they are acting by promoting drainage via trabecular route, like your pilocarpine, like promoting drainage through this. Whereas the brimodine alpha agonist, it's a carbonic anhydrase enzyme blocker, timolol beta. All these are inhibiting aqueous production. Okay. Next, indication to start desferrioxamine in a child when the iron load is more than the iron load more than 500, we can start desferriaxum. Answer D. Answer D. Very good, ma. Very good. And then, can you please answer? A person accidentally exposed to smoke from fire, present with nausea, confusion, and shock. Examination has bitter almond odor breath. Venous oxygenation was more than 90. What is the most preferred treatment for this case? First, can you please tell what diagnosis? It's a case of cyanide poisoning. Cyanide poisoning. Now all must answer for this case. What is the best drug? Best. The best is hydroxycobalamin. See, man, nitrate can be useful. I do agree because they forms methemoglobin, thereby useful for treatment of cyanide poisoning. I do agree, but comparing to amyl nitrate, the best is go for vitamin B12 hydroxycobalamin. That's a fantastic drug for treatment of cyanide poisoning. Come on, sodium it causes adverse effect of cyanide poisoning because it containing cyanide. It causes cyanide poisoning. Okay, so answer is option number C, hydroxycobalamin. Okay, and then can I make a fast answer? I want antidote. Name the antidote for benzodiazepine. Answer? It is flumazenil. Flumazenil. Name the antidote for morphine. It is intravenous naloxone. Naloxone. And we also go for naltrexone as a adjuvant. But main choice IV naloxone. And for TCA poisoning, can you answer what the first line drug useful for treatment of TCA poisoning? Here they have metabolic acidosis. So the first line choice is IV sodium bicarbonate. Okay. For methyl alcohol, what is specific antidote? It is 4-methyl. So 4-methyl pyrazole. That is the first line drug. Adjuvantly, we can try ethanol, but choice is 5-methyl. Similarly, can I please answer what is the antidote for atropine poisoning? Physostigmine. Physostigmine can able to crosses the blood-brain barrier, useful to control both CNS and peripheral symptom atropine. So, physo is a choice. For digoxin poisoning, drug antidote mean go for digibind. Digibind. And for paracetamol, N-acetylcysteine. Okay. Now the question starts. Can I go for latest point? What a newer drug. Next 5 to 7 minutes. Listen. One question in this session, in this 5 to 7 minutes, one question definitely going to come. The question start. Matching the drug and the antidote. Ready? Apixaban antidote for dash. For apixaban, what the antidote? For apixaban antidote NEET alpha. Okay. For ethylene glycol antidote 5-episode. See, for methanol poisoning, for ethyl glycol poisoning, for both antidote is 5-episode. For amitriptyline bicarbonate and for valproate L-carnitine. See, valproate causes adverse effect of hepatotoxicity. To control this, we can supplement levocarnitine. It's an antioxidant useful to control valproate induced hepatotoxicity. So, answer is option number A. Okay, and then coming to next. Which of following is the melanocortin 4 agonist approved for treatment of obesity? Come on, man. Today we done melanocortin 4 agonist useful for female with HSDD bremelanotide. Similarly, I have one drug called set melanotide. Set melanotide is useful for treatment of obesity. Remember, bremelanotide useful for female with HSDD, whereas set melanotide useful for treatment of obesity. Okay, and see, semaglutide, a GLP-1 analog useful for treatment of obesity. Lorcaserin, a 5-HT2C agonist useful for treatment of obesity. but unfortunately, it causes adverse effect of gastric cancer. So it was withdrawn from market. Phentermine, a sympathetic drug acting on CNS, causing reduction of appetite by decreasing appetite, useful for controlling obesity. Anyway, by kind request in our DVD videos, we given complete list of drugs therapy useful for obesity. That is, what are the anti-diabetic like liraglutide, semaglutide, tirzepatide, like that some drug useful. For example, name the antidepressant bupropion plus naltrexone useful for treatment of obesity. So obesity is a very important topic. So please kindly go through DVD books, just image and points, okay? And then which of following is the NK3, that is neurokinin 3 blocker approved for treatment of post-menopausal vasomotor symptom? It is fezolinetant. Fezolinetant is a NK3 blocker useful for treatment of post-menopausal vasomotor symptom. And rolapatin is a NK1 blocker. NK1 blocker useful for treatment of vomiting, late phase vomiting due to anti-cancer drug. Rimonabant. Rimonabant is a cannabinoid 1 inverse agonist useful for treatment of obesity and for controlling smoking, but causes adverse effect of psychiatry problem. Because of this, it was withdrawn from market. Then pitolisant. Anybody want to answer? What is pitolisant? Anybody? What is pitolisant? It's actually H3 inverse agonist. H3 inverse agonist useful for treatment of narcolepsy. Narcolepsy. Pitolisant also called it also called as tipralisant. Tipralisant. It's also called tipralisant. Okay. Next, can you answer this question? Pozelimab. Pozelimab approved for treatment of what? Anybody? If you answer all the next question, down, you are the first to 5 rank actually. Hereafter, I have some question. If you answer all the question, you are the one going to get first to 5 rank. Ready? Pozelimab useful for Chapel. Very good. Chapel syndrome. Chapel syndrome is the actually, it's a autoimmune hemolysis with the PNH. For this case, we use one thing called pesolimab. And Rett syndrome we done already. That is trofinetide. And we have one thing called WHIM syndrome. That is what? Hypogammaglobulinemia, immunodeficiency, and myelocatasia. For this syndrome, we have one drug called Movorixafor. Movorixafor. It's a CCR4 antagonist useful for WIM syndrome. WIM syndrome. Hey, Shagil, fantastic man. You know this fantastic Shagil, Morovix. Actually, sorry, your spelling mistake, but you were right. It's a Movorixafor. Okay, Movorixafor. Good, congrats, Shagil. Good. And for Lennox-Gastaut syndrome, we know drug of choice is sodium valproate. So, drug of choice. Other drug, we can also lamotrigine, all these things, you know. Okay. Then, anybody? Omidinibac. Omidinibac. Approved for treatment of dash. So latest drug useful for treatment of glaucoma. It is also actually what is this? It's a prostaglandin E2 receptor agonist. See, normally for treating glaucoma, we go for PGF2 alpha agonist like latanoprost, bimetoprost, travoprost. But new drug, omidinibac. It's a prostaglandin E2 receptor agonist. It is also going to promote drainage, increasing drainage across via ileocecal route. Okay. Then some other newer drugs. Ready? for treatment of systemic lupus erythematosus, we have one thing called belimumab. Belimumab, it's a target against BAF, that is B cell activating factor. It's acting against B cell activating factor. So, drug name belimumab. Next, name the antibody useful for prevention of osteoporosis. One famous drug is denosumab. The question is, anybody? Denosumab. I want target. What target? The target is rank L. Rank L. By targeting against rank L, prevents osteoclastic action, inhibiting osteoclastic action. Okay. Next, tough question, tough question. For treatment of malignant ascites, we have an antibody called catumoxumab. It's a drug targeting against epithelial cell adhesion molecule. Epithelial cell adhesion molecule, also CD3. Catumoxumab, an antibody targeting against EPCAM and CD3, useful for malignancies. And then for IBD, we have some more antibody. For example, integrin antagonist. For example, we have alpha 4 beta 1 blocker called natalizumab. Alpha 4 beta 1 blocker, this one, whereas alpha 4 beta 7 blocker vedolizumab. Ustekinumab TK, interleukin blocker. I'm asking antibody. I'm asking about antibodies. Okay. And can you please answer this question? Natalizumab, antibody causing dangerously what ADR? It may cause adverse effect of progressive PML. Progressive PML. Myeloid leukemia. Okay. PML. And in this case, what is the most important infection? JC virus infection. JC virus infection also important in this case. Okay. Next. Can you answer? Name the latest FDA approved drug for treatment of PDP, Parkinson disease psychosis. For treating psychosis in Parkinson's patient, yes, good. P answering, it's a 5ST2A inverse agonist. It's a 5ST2A inverse agonist. Good, man, good. And then just 4 to 5 new drug. Please note, we have resmetirom. Very fantastic question. I think it's going to come, doctor. If you tell this answer, you are the best in whole India. Come answer. It's a recently approved drug, resmetirom. Useful for, yes, good, Shagil, fantastic, useful for NASH, that is non-alcoholic steatohepatitis. The drug is given orally. It's a liver-directed thyroid hormone receptor agonist. Thyroid hormone receptor agonist, approved for treatment of non-alcoholic steatohepatitis called NASH. For this using, okay, this is very important. Expect a question for this year. And then we have pimecilanum. That is something similar to beta-lactam antibiotic. Pimecilanum. It's actually a penicillin group of drug. Latest drug approved orally for treatment of urinary tract infection. Okay. Next, tovorafenib, RAF is a BRAF blocker, useful for treatment of brain tumor, glioma. RAF blocker. RAF, we have vemurafenib. Like that, tovorafenib is a RAF blocker, useful for treatment of glioma. Next, ritlecitinib is a newer drug, useful for alopecia areata. Covalent kinase enzyme blocker, useful for treatment of alopecia areata. Ritlecitinib, covalent kinase blocker useful for alopecia areata. And then very expected Danicopan. So latest drug is a drug complement factor D blocker useful for treatment of paroxysmal nocturnal hemoglobinuria PNH. Danicopan useful for PNH. Not Dukin, Shagil, not Dukin. But there are a lot of drugs approved for Dukin muscular dystrophy. It is for PNH, paroxysmal nocturnal hemoglobinuria. Okay, and vadadustat. It's a newer drug. It's called prolyl hydroxylase inhibitor, useful for treatment of anemia due to CKD. Anemia due to CKD. Vadadustat. And then Lonafarnib. Anybody? If you tell this, you are the most brilliant man, most brilliant. Actually, the New Delhi AIMS is going to beg you. Come and join in my college. Like that. If you tell this, such a very anybody? What is Lonafarnib? Yes, good Shagil. Definitely a very bright future waiting for you, man. It's a very useful for treatment of progeria. Look here, progeria. That is prematurely, there's aging. It's a farnesyl transferase enzyme blocker useful for treatment of Hutchinson-Gilford syndrome, also called Hutchinson-Gilford progeroid syndrome, called progeria. Can you please answer? At least tell what is the movie name. Hindi movie. What is the movie name? Okay. So here the prematurely there is a aging process called progeria. For treating this case using one drug called Lonafarnib. Farnib. Okay. Yeah, good. Wow, movie. Very good. Very good. Right. Next. Name the first hemoglobin oxygen affinity modulator approved for treatment of sickle cell disease. Actually, we have one drug called hydroxyurea for sickle disease. Okay, that's okay. But hemoglobin oxygen affinity modulator, that's called voxelotor. So, in addition to hydroxyurea, we have latest drug called voxelotor. It's a hemoglobin oxygen affinity modulator useful for treatment of sickle cell disease. And very easy question. Name the drug useful for obesity withdrawn in the year 2020 because of causing gastric cancer. That is larcasarin. Larcasarin, a 5-HT2C, a serotonin agonist, was withdrawn because of causing gastric cancer problem. And in antibiotic, cefiderocol, it's the latest cephalosporin approved for treatment of complicated UTI. And then plasmapheresis, a latest aminoglycoside useful for treatment of complicated UTI in adults. Plasmapheresis, a aminoglycoside. And then a small 2 to 3 new drug in HIV. Ibalizumab. It's an antibody targeting against CD4, thereby preventing binding of viral GP120 CD4 useful for treatment of HIV infection. So name the monoclonal antibody acting as a virus entry blocker useful for HIV. Ibalizumab. Similar to ibalizumab, I have one more drug called Fastemsavir. Fast mean pro drug. It becomes Temsavir. The Temsavir also viral entry blocker targeting against CD4, preventing the attachment of GP120 virus GP120 with the CD4 sub for Fastemsavir. Maravirac CCR5 blocker, whereas it's a CD4 blocker called Temsavir. And one more latest, lenacapavir. Look at spelling, lenacapavir. capsid. Virus capsid inhibitor. It's also called virus maturation blocker, useful for treatment of HIV. So today we new drug. One is Fastemcivir, Ibalusumab, Lenacapavir, all are newer drug useful for treatment of HIV. And then we have Letermovir. Letermovir is a newer drug useful for treatment of cytomegalovirus infection in a stem cell transplant patient to prevent CMV infection. But in this junction, you should know, please answer, originally, who is the first line drug choice for cytomegalovirus infection? We have something called ganciclovir. Valganciclovir. They are the choice, and both of them causing adverse effect of myelosuppression. Myelosuppression. Okay. Phoscarnet useful for resistant cases. I'm asking drug choice. First line choice ganciclovir and valgancil. If gans resistant mean, then we can try phoscarnet. Okay. Now, Tecovirimat is a newer drug useful for monkeypox virus infection. Tecovirimat useful for orthopox like smallpox and monkeypox virus infection called Tecovirimat. Then Nirmatrelvir plus Ritonavir. This combo useful for COVID-19 infection. Nirmatrelvir plus Ritonavir. Ritonavir actually a drug useful for HIV, also given with this agent for treatment of COVID-19 infection. And can you answer? Name the latest FDA approved drug that to antibody for respiratory syncytial virus infection. See, actually, we have one thing called palivizumab. It's an antibody useful for RSV, but the latest is nirsevimab. Latest is nirsevimab, useful for treatment of respiratory syncytial virus infection. And finally, a latest drug useful for type 1 diabetes mellitus. We have teplizumab. Teplizumab target important. It is targeting against CD3. CD3 targeting against CD3 useful in type 1 diabetes. Drug name teplizumab. That means, doctor, I covered all the most expected area in all the chapter. Vital areas GP, ANS, CNS, autocoid, anti-cancer, immunology, newer drug, clinical trial. All this I covered with this one latest drug, momelotinib, a newer drug called Janus kinase 1 and 2 blocker, useful for treatment of myelofibrosis with anemia. Momelotinib. Okay, I think this definitely from this 70 question I'm expecting with the God grace. Definitely hope for the best. So all the very best. You do well. Don't get panic. Be calm. Rest. Don't get restlessness. Enjoy life. Tomorrow take good amount of rest. Just revise your DVD notes. Don't do extra things and all. Just be calm, relax, enjoy, and just rehearse in your mind what are things I'm going to do, and just see your DVD notes. That will be the most useful. So my good wishes to all of you. So do well. May God bless you. Thank you very much. Have a wonderful day. I'm expecting all to become a very good Downsonian should become Aimsonian. That's my aim. So do well. All the very best, doctor. Very best. Thank you. Thank you very much.